Hello, we're answering questions on sexual health. I'm joined by Dr. Catherine Hood. Hello.
Hello.
Catherine, I've got a question here from a 26-year-old young man who's recently been experiencing prolonged erections of, he says, between 4 and 6 hours, which sounds really uncomfortable. Now, he says he's on medication for an unrelated condition, and he says, could this be the cause?
Okay. The first thing is he really does need to go and see somebody about this, because having an erection that lasts that long can be quite damaging. It's a condition that we call priapism. And really, if you have an erection that lasts, well, 4 hours or over, it can start to damage the penis, and actually in the future could lead to problems with getting erections in the first place. So it is important he goes to see somebody to try and find out what the causes are behind it. Now the thing is, when you have an erection, what happens is that blood flows into the penis, and that's what makes it hard. And anything that stops blood flowing out of the penis again is going to make it difficult for that erection to disappear.
Hence the damage that could be done.
The damage, yeah. And there are many things that can damage that mechanism of blood going in and blood coming out again. Certainly prescribed medications can do it. Some of the older antidepressants have been known to cause this side effect. But also recreational medicines that he may or may not be taking, such as marijuana and cocaine, have been linked with prolonged erections as well. So if you go to your doctor, it's very, very, very important he's totally honest about what he is taking and open. There are certain health conditions as well that can lead to problems with the erectile apparatus. Sickle cell disease is one. If sickle cell runs in his family, then it may be that it's worth him being checked out for sickle cell.
But he really must go and talk to somebody.
He really does need to go and talk to somebody. And the other thing is, if it does happen, if he has a sustained erection, because it's very painful having this.
Yeah, I would have thought it's incredibly uncomfortable.
Exactly. The thing is, you'd need to get help to sometimes reduce the erection. Don't try and do it yourself, because you can cause further damage.
Right. So this is an area where you do need help, and you need to be honest about everything that you might be taking. Good advice, as always, Catherine. Thank you. Well, if you have a similar problem, we hope we might have given you some help, but remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.